in this clip about asthma and the histologic changes that occur with this disease. So it's considered an inflammatory disease of the airways that leads to hyperresponsiveness, to obstruction, to mucus overproduction, and that leads to histologic remodelling of the airway walls. So we're just going to look at that in a lung biopsy. A biopsy of lung here, you can see the delicate alveolar septa creating those alveolar spaces, quite a lot of blood vessels, and most of the changes that you see occur around the bronchus, and we're just tracking over to one now. That was some cartilage. So we've got a normal bronchus here, and it is quite large, as you can see. It has a epithelium lining around the outside, and the white space should be the lumen, and it's filled with a large plug of mucus. There's just a bit of cartilage there from the ring around the bronchus. As we track up here, you can see the epithelium lining that space, just delicate, one layer thick columnar pseudostratified epithelium. And then we've got some other types of tissue we'll look at in a little more detail. This is the plug lying in the middle, and you can see it's kind of fairly amorphous, a little bit fibrillary. It has cells inside it, so these ones are macrophages, pulmonary macrophages. They've got one nucleus and a fair amount of cytoplasm. Then the longer cells you can see now are columnar epithelial cells that have exfoliated off and are trapped in that mucus plug. This is the epithelium here. You can see it's pseudostratified columnar epithelium, and you'll see that underneath it there is a layer of fibrosis, and then these cells I'm pointing at, so quite a number of leukocytes just in a submucosal place. This one here I'm pointing at has two little nuclei like eyes and red granular cytoplasm. That's an eosinophil. There's actually quite a lot of them, and this is a characteristic of asthma, is an eosinophilic infiltration under the mucosa. You can see there's actually quite a lot of them, so they don't always have two nuclei, depends on how they've been sectioned, but I'm pointing out quite a lot now. Once you see one, you see a whole lot of them. So that's eosinophils. You'll notice as well as that mucus plug, there are goblet cells in this epithelium, so with the big hollow vacuoles, and there's probably more of those than you would normally see, so there's a bit of a goblet cell hyperplasia that's helping to create all that mucus that's filling the bronchus. Just going back on low power, there's a couple of other things that you often see as well. So there's our mucus plug there, and then underneath the mucosa again we've got a couple of areas, so different types of tissue, and these areas are smooth muscle tissue, and again, and up there is glands. So the smooth muscle has undergone hypertrophy, and that's due to increased use of the muscles and the contraction that happens in the attacks with asthma. So smooth muscle hypertrophy, and then just above that we'll have a look at so that's a smooth muscle in little bundles of cells. And just above that, they're not staining very palely, but these are submucosal mucin glands that have undergone hypertrophy as well. And just going to high power, you can barely see them, so they're very clear, like goblet cells. They have nuclei arranged around the periphery of the gland, and so often you'll see a hyperplasia of those as well, helping to contribute again to all the mucus that you see in asthma. So just to summarise the changes that are seen in histology sections from patients with asthma, firstly, excessive mucus, and that often forms plugs that are present in the bronchus, eosinophilic infiltration underneath the epithelium, submucosal, a hyperplasia of goblet cells and of submucosal glands that contribute to the excess mucus, and then a hypertrophy of smooth muscle around the walls of the bronchus.